Empowering healthcare workers. The impact of DKT training program in Adamawa State. In the remote communities of Adamawa State, Nigeria, access to quality healthcare has been a challenge for many. However, a beacon of hope has emerged through the DKT training program, empowering healthcare workers with knowledge and skills to positively impact the lives of thousands. Join us on the journey as we explore the roles and impact of this program on healthcare workers in Adamawa State. National Hospital Sales and Clinical Service Manager DKT speaks on the mission and what this intervention seeks to achieve in the state.
So basically, DKT International Nigeria is happy to collaborate and partner with the government of Adamawa State, particularly the State Ministry of Health and also the Primary Healthcare Development Agency. So our mission here is to implement the task-shifting tertiary policy of the Federal Ministry of Health. That's actually on family planning. So we're training nurses here. We're actually training about 40 nurses in Adamawa State on family planning, on LARC, that is long-acting reversible contraceptives. And the reason we are doing this is to actually bridge the knowledge gap, because we understand that in the state we have some knowledge gap, and DKT is partnering with the state to bridge this gap. And in addition to this, we are also donating 10,000 units of Lydia IUDs, copper-bearing IUDs, to the state to support and strengthen the family planning services in the state, and to ensure that all women of reproductive age actually have access to quality, effective, affordable, and effective family planning products and services in the state. So we want to ensure that these providers go back to their various communities to offer long-acting reversible contraceptive services to all women across their communities. So this partnership just begun with this training in Adamawa State. We have other programs we intend to roll out in due course to ensure that the family planning services in the state is strengthened.
In Adamawa State, healthcare workers face numerous challenges in providing quality care, including limited resources and lack of proper training. Aishatu Garba Abubakar, the State Family Planning Program Officer, Adamawa State Primary Healthcare Development Agency, sheds more light on the significance of this collaboration.
Adamawa State Primary Healthcare Development Agency, in partnership, has a good working relationship with the DKT in the state, and DKT are very impressive and supportive in our state. They are supporting in family planning, that is in terms of training capacity, and also in terms of procurement of family planning commodities. When DKT came with this motion of training in the state, we as the stakeholders, that is Adamawa State Primary Healthcare Development Agency, we support this program. It was so impressive to us because as at now, the Adamawa State Primary Healthcare Development Agency has a low number of health workers who have been training in LARC. So with the supportive of this DKT on this training, then we will be able to boost our MCPR of the state, that is from 18.2 to 27% at least at the end of the year. And also we can be able to reduce our unmet needs from 29.8 to at least 10%. And also our uptake of family planning will increase. Also the coverage will increase, the demand creation will also increase.
Recognizing the needs for training, DKT Nigeria, in collaboration with Adamawa State Government through the State Primary Healthcare Development Agency, launched a comprehensive program to equip healthcare workers with the skills and knowledge required to improve reproductive and sexual health care services. The representative of the Federal Ministry of Health, Nneka Oteka, expressed satisfaction with this exercise.
I am so happy to be here with DKT to be part of this project. DKT, they have been doing a lot for the country, for the collaboration of Federal Ministry of Health. You know, the government cannot do it all. They have decided on their own to go into several states to assist the states in making sure that reproductive health is well covered, that all women of reproductive age will access the commodities, the products of their choice, and all the commodities are free. They don't pay for the commodities. So we are here to train some PhD nurses so that they will be able to be providing the services in their various health facilities.
Equipped with the new knowledge and skills, healthcare workers now become beacons of light in their respective communities, transforming the lives of individuals and families they serve. The participants who are healthcare workers share their experience and stories from the impact and knowledge gained from this intervention by DKT in Adamawa State.
Just like your Janelle, because everything is the same. The same. But
my experience was so good. I had an experience that is amazing and I believe will last long. It's so good going out and see women turning out to accept family planning, especially the implants. It's so encouraging and so mind-blowing. I'm glad I'm part of this training myself. I have improved myself so well from the training. I'm going out and met women, different communities, different religion, different beliefs, but we all came to agree on family planning, which is good and loving.
So as a health practitioner in my field, the gap that I had in my field was the availability of these methods of family planning. That's the IUD and the implants. So in the case whereby I don't have much of those equipment in my facility, it just weakens me that after all this explanation, after convincing this one, then I'll end up telling her I don't have this method available in my facility. But we thank DKT for making all this available to our facilities. Now I can confidently speak and convince every woman that comes to my facility on family planning method. Like before, I do have fear of inserting the IUCD because I'm not that well trained, should I say, like specifically trained on this. But this time around, a good time have been taken to teach me this, so I'm confident enough to insert IUD or to put implant. As I just did one today. Yeah, I just did one at Jambuto Primary Healthcare today. I'm really happy.
In the face of adversity, the DKT training program has empowered healthcare workers in Adamawa State, enabling them to bring quality care and healthcare services closer to the communities. By investing in their training, DKT has sparked a healthcare revolution, transforming lives one patient at a time in Adamawa State.